So we're back for our third Q&A this week with our Director of Public Health, Steve Pintus, who you can see on the screen in front of you. And we're, just as before, we're going to put some questions to Steve from members of the public, questions that are coming up quite frequently on social media and elsewhere from our residents. Steve, I'm going to dive right in this week with a kind of big one. Is it getting worse in North East Lincolnshire? Is COVID getting worse?
Yeah, thanks, Ross. I think we talked about this in the last session. Yes, it is. It's getting worse, and I think this was predicted that there'd be a second wave, and it's undoubtedly we are in the second wave. The numbers have gone up quite dramatically. We're probably now seeing something between 70 and 100 cases, new cases of positive tests every day, over 500 a week. So it's definitely out there. And I think it's undoubtedly touching everybody's lives, whether that's that they know they've had a test themselves, whether that's positive or negative, or they know somebody in their family or who they work with that have had a test, or they've been contacted by the contact tracing service. It is probably now really apparent to everybody that we are in the midst of the second wave of this pandemic, and we all need to act accordingly.
Going on to the second question, and this is from Roy, and Roy asks, given that the rate of infection in North East Links has now risen to 349 cases per 100,000, more than double the UK average, and the absolute numbers nearly doubled in NEL in the week 24th of October, at what point will the Director of Public Health be recommending that we move up the tiers? I know there's been announcements about this this week, Steve, so maybe you want to talk a bit about those.
Yeah, I guess we're keeping a constant review on the data, and we're in dialogue with our colleagues both at the region and at the centre, looking at that data and looking at the triggers for moving up the tiers, and certainly when we look at it across the Humber, it's undoubtedly that it has got worse, and we are moving ever closer to the criteria, meeting the criteria for going up the tiers. So that's largely a consensual decision that needs to be made between local politicians and the centre, and we are following the due process at the moment, and like I say, reviewing the data, assessing whether from a public health perspective are we meeting the criteria, and if we are, what's the process for engaging central government about going into another tier. So I think watch this space, and decisions that will be made in the coming days and weeks about that, and no doubt will come out later on. I think the important thing, the tiers is one element of the response to the increasing numbers, and we will be able to give advice and guidance about the differences when and if that occasion arises. I think the main concern, and why we're really keen to really push the messaging, is that it does represent greater numbers in our older population, but increasing at the same rate, if not faster, and that's a really good indicator of increasing pressure on our hospital system. And it's not that they're being overrun with people poorly from COVID, but they are seeing more and more cases of people testing positive with COVID, and that all needs managing within the hospital, and that affects their capacity. Their staff are being affected, that affects their capacity to basically do their normal business. So it's really important we try and keep the normal business going that enables poorly people with surgery needed to be able to go and get that done without being affected by less capacity in the hospitals because of COVID. So everyone can play their part and help protect the hospital from getting overrun with COVID cases. So the tiers is almost, you know, irrelevant in that respect. Whatever tier we're in, we still need people to follow the guidance and try and keep COVID at bay.
There's obviously people that it's having a more adverse effect on. It's turning people's lives upside down. What support is out there for people who are, you know, if they're having to self-isolate, take time off work, if they're struggling with their income, or they're struggling with their health? Is there any support out there that can claim?
Yeah, I mean, I think we developed a very good support system in the first wave, and that's still out there. Some elements of it have been dormant, but they're starting to be reactivated as we see the increase in numbers. So there's a whole array of support that's been in place, an extensive voluntary sector network who have really stepped up when necessary and shown how good people are in North East Lincolnshire, how community minded they are in terms of support and volunteering. So out there in the community, there are organisations working very closely with communities. There is access through those organisations to hardship funds if people are really feeling the pinch. For those people that have to self-isolate, there is the access to the £500 payment, and they can contact the telephone number 313131 to access the support and see if they are eligible. So the furlough scheme, I think, when it comes to the end, will be replaced by the job support scheme from the 1st of November, and employers will be able to access that through government channels. So all in all, we're trying to maintain that level of support for people in North East Lincolnshire, but predominantly, really, it's a measure of the way that people have stepped up and providing to support to each other. That's the real success, I think, in our area.
Absolutely, and we've got some wonderful communities out there as well that are being phenomenally supportive of each other. Steve, is it worth saying a message about half terms? Because obviously some schools will be coming to an end this weekend and then going back on Monday. So those that have been out the area. I think what I'd want to say, Royce, really is I think it's that probably what we're seeing is that we had very low levels during the summer, and I think people relaxed, and those people that didn't think COVID was around, it reinforced their view because they didn't see it. And I guess what people are having to do is to really to step up now and get out of that relaxed mode and really start again to be vigilant and focus on what they do and be more self-aware about the risks and the behaviours that they adopt. So I think that applies as much to holiday time as it does to when the kids are in school. Obviously people may have been away, and again they may relax, the guard is down, the parents might be away from work as well. So it's just been really aware of the risks and following the guidance, and if people do follow the guidance, they avoid being identified as a contact, and that way they avoid the need to have to self-isolate. So it's really about mutual benefit. What we want to do is to keep North East Lincolnshire safe, keep the hospital functioning, but we also want people to be able to carry on in their lives, in their jobs, and the best way to do that and to minimise the risk is to follow the guidance. Hands, face, space, and obviously if you're experiencing symptoms, isolate.
Yeah, totally.
And then get a test.
Indeed.
Okay, brilliant. Well, thank you for joining us this week, Steve, and hopefully we'll see you again next week with some more questions.